Alright, so let's talk about traumatic head injury leading to either epidural hematomas or subdural hematomas. And before we get into this, we're going to cover the meninges a little more. So the meninges is this stuff right here, which is right below the skull, which is the bone. This bone is the skull. Okay. So we see that the meninges are three layers. There's the dura, the arachnoid, and the pia mater, and that they are right between the skull and the brain. Okay, the dura mater is right below the skull. It's tightly attached. It's pretty much glued to the skull. It's very tightly glued to the skull, and we'll understand why that's significant later. Next is the arachnoid layer. It's below the dura. It's attached, but not too tightly attached to the dura. And then finally we have the pia mater, which is right on the brain. This is the wrapper. The meninge is all a wrapper for the brain in my mind. This is the one that's in direct contact. It's like saran wrap to the brain. Okay. So for epidural hematomas, then, if you look at the name, you would understand that the hematoma is going to be above the dura. It's going to be between the dura and the skull. Remember, there's a tight attachment. And then the subdural hematoma then would be below the dura, between the dura and the arachnoid layer. Which are not as tightly attached. And in a epidural hematoma, the vessel that is damaged is the middle meningeal artery. And note that this is a high pressure vessel, and we'll see that's why that's important later. And then for the subdural hematoma, it's a bridging vein rupture. This is a vein, so it's a low pressure vessel. Remember both of these vessels and which one is which. And the mechanism of damage here for the epidural hematoma is usually a skull fracture of the temporal bone, because the middle meningeal artery runs right below that bone. Subdural hematoma can have multiple causes. It can be either an acute cause or a chronic. There can be a high energy impact, basically stretching out the bridging veins in your head between the dura and the arachnoid. The bridging veins get stretched out too much and they rupture. That's a acute event due to high energy impact. In a chronic event, what you have is you have a mild trauma, but the patient is old. Okay, so they have a cerebral atrophy. The brain shrinks down. So when the brain's already shrunk down, let's see. Let me try to explain this. Okay, so this is a normal brain. Okay, this is brain. This is the arachnoid. This is the dura. Okay, and then we have these veins here connecting the two. Okay, when the brain shrinks, it's going to shrink. Okay, now it's shrink. There's more space, and now your veins are under high tension. Okay, there's higher tension, so they're getting pulled already. They're getting stretched, so they're easier to break. And you get some mild trauma. Mild trauma comes, and then it snaps. Your little bridging vein snaps, and you get bleeding. So the way that we'll start with epidural hematoma again. The symptoms here in an epidural hematoma are a lucid interval. What this means is you get an initial loss of consciousness, and that's due to the high energy impact. It's going to cause it's a concussion. Basically, you lose consciousness with a high impact, and then the patient wakes up. They're doing good, they're normal, and then they deteriorate, and then they get worse and worse, and then they lose consciousness again. And the reason for that is you have this high pressure vessel pumping out a lot of blood into the epidural area, causing a lot of pressure. And all this pressure is going to cause them to deteriorate. It's going to press pressure on the brain cells and cause them to deteriorate. They're going to lose consciousness. Okay, so that's the lucid interval. That is a very characteristic thing of epidural hematoma. You're going to see them. They're going to lose consciousness, wake up, and then lose consciousness again. You're going to know that's an epidural hematoma. It's so easy. Subdural hematoma depends on the size, location, rate of growth of the hematoma, but it's very generalized symptom. It doesn't really tell you much. Headaches, altered consciousness, and then the imaging finding often will be key. You're going to get any of these patients. You're going to get imaging. You're going to see this bleed, and then this one is a lens-shaped bleed. Okay, it's a lens. That's an epidural hematoma. It's because the dura is so tightly attached to that skull. You're trying to pry apart the dura. You're trying to pry it off of the bone. That's why you get this lens-shaped. Okay. And then for the subdural hematoma, it's much less tightly attached, so you get a little crescent instead. You can nicely spread out and push apart the arachnoid, push the arachnoid away from the dura. So crescent shape is subdural, lens shape is epidural. I don't think you need a mnemonic for this. Just remember that the dura is so tightly attached, and you get this high pressure artery rupture. That high pressure, you need the high pressure artery to be able to push that dura away from the bone, and you end up having a lens shaped blood with the lucid interval. And then the subdural hematoma, then it's through the vein rupture, lower pressure, pushing the arachnoid, which is not as tightly attached to the dura, and then you get this nice little crescent shaped area of bleeding. Alright, so now we can summarize our intracranial bleeding. Remember, we had some bleeding, the hemorrhagic strokes that can cause focal neurological deficits, including the intracerebral hemorrhage and subarachnoid hemorrhage. And then we also have these traumatic hematomas that cause bleeding as well. So this is a nice summary of all our intracranial bleeding. I like to divide it into either the stuff below the meninges, so it involves the brain, and that would be the intracerebral hemorrhage. And do you remember what causes? Remember, there are many causes of intracerebral hemorrhage. We covered a few of them. Do you remember what any of these were? Remember, there was the Charcot-Bouchard aneurysm ruptures due to hypertension, and then there was the cerebral amyloid angiography in elderly patients, and then the arteriovenous malformations in younger patients. And can you identify which one of these pictures is the intracerebral hemorrhage? Remember, it was more of a focal bleed. We see a focal bleed here. This is the intracerebral hemorrhage in the deeper part of the brain. Next, we have involving the meninges. So we have the epidural hematoma. Remember, that's above the dura. So it's between the dura and the skull. It's a very high pressure artery that gets ruptured. The key thing that we saw here was the lucid interval. They lose consciousness. They wake up. They're doing fine. And they get worse and worse. And then they lose consciousness again. That's the lucid interval. And then do you remember which one of these pictures that one was? Remember, that one was the lens-shaped one. When it's a high pressure, you need high pressure to pry that dura off of that tight bone, so you end up with a lens-shaped bleed. And then the subdural hematoma, remember, that was due to the rupture of the bridging veins. It could present very vague symptoms. Which picture was that? Remember, that one was the one that was the crescent. Okay, subdural was the crescent. It's because the arachnoid is less tightly attached to the dura. And finally, we have the subarachnoid hemorrhage. Do you remember what was the cause of that normally? Normally, it was the rupture of the berry aneurysms. And what was the presentation of that? Do you remember? Remember, that was that sudden onset, thunderclap, worst headache of life. And then also the neck stiffness, and then you get blood all up in here. And that space, the subarachnoid, so under the arachnoid, between arachnoid and pia mater. Okay, and then that's obviously then going to be this one, and it's the one with like the starfish. It fills up the little grooves here. That's where it fills up. So the blood in the grooves. That's what you're going to get. You're going to get the starfish appearance of blood. So this is all the intracranial bleeding that you need to know. Some of them include causes of hemorrhagic stroke. Some of them resulting from trauma.